Minister, I think it's fair to say that school communities around Ireland are this morning grappling with another chaotic management of messaging and leadership from your department. You and I are in absolute agreement that it is incredibly important that schools will remain open. It is profoundly damaging for children when schools are closed. And when they were closed, we know that it was very difficult for students, and particularly those in disadvantaged areas and those with additional needs, to get the type of educational services that they absolutely needed. However, what the department has been saying, and what government has been saying for the last 18 months, that schools are safe, schools are safe, schools are safe. Now, last month I stood here and asked you and your government to stop saying that, but you've been repeating it. Schools are safe, schools are safe, schools are safe. Last week we heard a new line from NEFIT that we never said schools are safe. And now, having taken 5 days to consider what NEFIT have suggested in terms of mask wearing for 9-year-olds, for third class and up in primary schools, we get an overnight diktat from the Department of Education, delivered with all the subtlety, compassion of a gas bill. And this morning, principals have to police the mask wearing of 9-year-olds and up, third class and up, without any sense of what the legal implications are if a parent was to refuse, with no sense of a lead-in period, and with an absolute absence of commentary, guidance or leadership from yourself. All we needed last night was some kind of a video message or some kind of a communication from the political leader of education in Ireland to say, we know this is a change, we know this is difficult. Parents, we know that you are part of the solution here. Talk to your children. You know, as children, you've seen adults wearing masks. We're trying to make sure that people don't get sick, and you can help us in that. Don't feel anxious. Don't feel worried. We can get through this together. You're all part of this solution. Nope. We got a classic, soulless communication, followed up from a communication from NEFIT to each individual school, from Tony Holohan. This starts tomorrow. Required. Now, after everything these schools have been through, after you were asked last April to do something about antigen testing and you did nothing until this week, after all the failures of communication heretofore, after parroting this line about schools are safe, schools are safe, schools are safe, you're giving principals and school communities 16 hours to get their act together to enforce a diktat, a requirement from your department on face mask wearing amongst potentially very anxious children, with zero compassion, zero leadership from your department. You've been described as a government as a bad Debs committee. And that's the best description I can come up with this morning. So, Minister, I'd like you to respond to that, but maybe not to speak just to me, to take this opportunity actually to speak to the children of Ireland who may actually see this contribution later today.
Thank you, Leathca Hiarach. And I thank the Deputy for giving me the opportunity to outline, as he has requested, to the House the current position in relation to COVID-19 infection prevention and control measures in schools. Ensuring that schools can continue to operate through COVID-19 has been a key priority for Government. The Department always has been guided by our public health authorities, such as the NEFIT, the CMO Dr Tony Holohan and the Health Protection Surveillance Centre, in relation to the appropriate COVID-19 infection prevention and control measures in place in schools. Additional funding and staff have been made available to schools to support the implementation of these measures. Furthermore, I would like to record again that I am deeply appreciative of the work that has taken place and continues to take place on the ground in schools around the country to implement these very specific public health measures. As the Deputy will be aware, there have been a number of additional measures recommended by Public Health recently. Firstly, the Department of Health and the HSE, working in collaboration with the Department of Education, recently commenced a programme in which antigen tests are made available to children in primary schools when a case of COVID-19 arises. The Deputy will also be aware that there were varying views at various times in relation to the effectiveness of antigen testing, but it is now the strong recommendation of the CMO that there is a place for antigen testing as an additional tool to augment all the other tools that are in our schools, and for that reason, as Public Health have recommended it, it is now going forward. And so parents and guardians of a primary school child who is a confirmed case of COVID-19 following a PCR test are asked to inform their school's principal. The school principal will then inform the parents of other children in the pod of a confirmed case. Where there are 2 cases in a class and more than 1 pod within a 7-day period, antigen testing will be provided to every child in the class. No personal details of the child will be shared. These parents will be provided with the option to receive free antigen tests for their child, which they will be able to order using a free phone number for delivery to their home. School principals will not be required to gather evidence of participation of any antigen test results. Information materials for parents has been shared with schools last week and publicised directly to parents. Furthermore, it has been referenced, following recent advice from NEFIT, the Government have also approved the measure of the wearing of face masks by children aged 9 years and older in a number of settings, including for children in 3rd class and above in primary schools. Guidance has issued to primary schools on this basis, setting out the recommendation and the exemptions which apply in respect of children with medical or special needs. I want to be very clear here that, of course, it may be difficult for some students with special needs or with certain medical issues to wear face coverings. Schools know their children and are best placed to identify those children whose complex needs are such that the wearing of face coverings may not be possible for them, and to discuss this with parents as required. Schools have been provided with guidance and with information for parents and children. It is expected that schools, as usual, will take a practical approach over the next day or 2, as has been communicated, in order to communicate the new measures to parents and ensure parents have the opportunity to provide masks to children. The measure is being introduced on a temporary basis and is subject to review in mid-February of 2022. You will appreciate, Deputy, that this is a public health measure. It is guided by public health. It is the strong recommendation of the CMO and indeed of NEFIT that this is an additional tool for our schools. Equally so, I'm very conscious that the decision was taken yesterday, but schools have been given the latitude over the next number of days to engage with parents, to engage with students in relation to the wearing of face masks. And equally so, just to confirm that this wellbeing approach has been typical of the wellbeing approach that we have taken since the reopening of schools. It is a public health measure in the best interests of children, as advised by Public Health, for the protection of children individually and collectively, and indeed the school community. Thank you.
Sorry, Minister, look, you can't stand here and tell us that it's a public health measure and sure that's just the way it goes. You have in your answer to me here saying it's a practical approach over the next day or 2. What kind of leadership is that? What kind of certainty is that? What kind of legal basis is there for this? What happens if somebody comes to the school gate and flatly refuses for their child to have a mask? What does the principal do then? Do you know? Have you told them in the 16 hours you've given for them to prepare for this? We all know that we're trying to protect people from getting sick, getting hospitalised and ending up in ICU. We all know what the point is here. You were the ones telling us for the last 18 months that schools were safe. Schools are safe. Schools are safe. When school communities and principals and school managers were screaming out for support, and I think your department are depending on the goodwill of principals who are hardwired to ensure that they give the reputation of their schools, they defend the reputation of the schools at all costs with their own school community, to ensure that there aren't high anxiety levels amongst their student body or their parent body, to ensure that actually they keep the show on the road, rather than telling the truth of what's happening. So, practical approach over the next day or 2. says the department. No understanding of legal implications, no reference to the potential for HEPA filters to be put in schools, no understanding of the nature of the heat bills that schools are facing, and no leadership at all last night from yourself, Minister. So please don't throw it back at us to say that we are somehow not adhering to public health advice, when your own Minister for Health was a bit sketchy on that last night. So, what I would say to you, Minister, take the opportunity, show some leadership, give some guidance to schools and school communities, and actually to give some guidance to principals who are doing their best to deal with anxious children, who I have to submit have let down in this regard, because what they needed last night was a voice of compassion and care and leadership from the political face of education in Ireland.
Minister to conclude. Thank you very much, Cahill. I wish to thank the Deputy again for giving me the opportunity to outline to the House these measures. I would like to reiterate that if there are particular outbreaks of concern in educational facilities, public health teams continue to provide support to schools should it be required, and the measures that we've implemented in our schools are on the back of expert public health advice. The on-the-ground experience of public health doctors has been and remains that schools are relatively low environments in terms of transmission and have not been a driver of transmission in children over the course of the pandemic, and that has been reiterated by our CMO and the NEFIT on an ongoing basis. The government is committed to supporting schools and keeping school open for all children as we continue to live with COVID-19. The aim of all of the COVID-19 infection prevention and control measures that have been put in place for schools is to support schools to operate safely and prevent the introduction of COVID-19 and also the onward transmission of COVID-19 among the school community. Specifically in relation to the measures that were confirmed by government yesterday and guidelines issued to schools. And I think it's important, Deputy, because I've heard from you and indeed from others about the necessity to get the guidelines in place as a matter of urgency. Guidelines are required. We did that yesterday, but we are very clear in the guidelines. And I know schools. I have spent the vast majority of my working life in schools. I have the floor, Deputy, and I am aware that schools take a flexible approach. We have advised that they take a flexible approach over the coming days.
Requirement. The word requirement was used. That's not flexibility.
Deputy, please.
Yes, I do believe I have the floor. Thank you. And grandstanding on a matter of public health serves no good purpose.
For the love of God.
In terms
for the love of God. If I hear that for accusation one more time.
In terms of the opportunity to address the specific question, Cahill, look, I would beg your indulgence. In relation to there being an opportunity for schools to take a flexible approach, as they always do on an ongoing basis, they have that flexibility over the coming days. The vast majority of parents are very familiar. Indeed, from last week, I'm familiar myself that in schools that many wore masks, on the word of the CMO last week. We are taking an approach that is advised by public health. It is a measure that is regarded as an additional tool for the benefit of our schools, and we are implementing it. And we are asking parents to cooperate, as they have done magnificently up to this point, and I have no doubt that they will do so going forward. It is operating seamlessly at second level. This is a mirror reflection of a measure that is regarded by public health as a public health measure. Specifically in relation to resources going into schools, because you've made that inference, over 700 million has been expended in terms of resources being made available to schools for a variety of infection prevention and control measures. And specifically, I have to conclude, in relation to ventilation, I want to be very clear. On a case-by-case basis, as you would appreciate, Deputy, no two schools have the same requirement when it comes to ventilation.
Thank you, Minister.
It is the strong advice that natural ventilation is the best ventilation, but where there are specific issues, the department has engaged on a case-by-case basis with schools, whether it's for increased vents, windows or whatever. Monies have been paid, work has been done, and if HEPA filters are required, that's also a measure. Thank you.